I thank the Under-Secretary General and Chief of the Cabinet for her statement. I now give the floor to Mr. Anthony Banbury, Special Representative and Head of the United Nations Mission for Ebola Emergency Response. Anthony.
Thank you, Mr. President, and good morning, Excellencies, ladies and gentlemen. Mr. President, thank you very much for the leadership that you have shown as President of the General Assembly on the matter of the Ebola crisis. Following the extremely rapid passage of General Assembly Resolution 69/1, the United Nations Secretariat has been very busy in implementing the decision and the will of this body, with the support also of the Fifth Committee of the General Assembly and the rapid passage of the Commitment Authority to enable our operations. I'd like to also acknowledge the presence of Minister Tolbert Nisimwa from Liberia, my friend and colleague with whom UNMEER is privileged to work very closely with in Liberia, as well as General Keta, head of ASOA. Mr. President, before I go into my remarks, I'd like to very briefly show just a few pictorial slides to illustrate the march of this elusive disease, as the chef de cabinet referred to it, across time in the affected regions. So if we can please see the slides. There. Okay, the slides just depict the geographic dispersal of the disease, and by doing so, I think, highlight the challenges that we are facing. So if we just look across time from May, these are not cumulative cases. This is the shifting nature of it. August, September to October. Now, so you see by the moving red dots, it illustrates the challenge of responding to the disease where it is. And then the next few bar graphs just show the evolution on a week-by-week basis of the disease. So in Guinea, in Liberia, where you see a marked improvement in the weekly caseload, and in Sierra Leone, where, of course, there's been a dramatic deterioration. And unfortunately, we have just passed the grim milestone of more than 5,000 confirmed deaths caused by the disease, and the real numbers are likely to be much greater. One of the points that government leaders have stressed to me repeatedly in my travels and consultations with them is the impact of the disease across all sectors of society. Not only is it making people sick and causing multiple deaths, it's causing fear and upending the way of life, but the devastation goes far beyond the human toll. UNICEF estimates that there are more than 3,300 Ebola orphans, and I saw at many visits to Ebola treatment facilities, these young children orphaned outside the treatment facility where one parent had died, another parent was ill. It wasn't clear whether the child was Ebola positive or not, and it was truly a tragic sight. WFP has warned us about dramatically rising food prices and how more and more families are living on one meal a day. Schools are closed, livelihoods have been lost across the region, markets dramatically impacted. The prefet in Gekadu talked to me about how there had been a thriving regional market in Gekadu, but now traders were afraid to even come to the town for fear of Ebola. The Economic Commission for Africa has reported that the reduction in mining activities in Sierra Leone has resulted in a 21% drop in government revenues. And in Guinea, coffee production is down by 50%. These are just some of the many numbers that can illustrate the widespread impact of the disease beyond the public health sector. And of course, it's not just a risk to the population of Guinea, Liberia, and Sierra Leone. We see now terrible developments in Mali, where the government had responded so fast to one case and things looked like they were under control. But now another case has been reported. A local leader has passed away. He visited 3 medical clinics before doing so and then was brought back to his village where traditional burial rites were performed, potentially exposing many more people, and now Mali is very much on our mind. It's worth bearing in mind in the case of Nigeria, where there was just one transportation event, one Ebola victim arrived, there were 899 contacts, there were 54 contact tracing teams, and over 18,000 visits necessary by the government health workers to get that one case under control. In many of the countries of that sub-region in West Africa, the healthcare infrastructure is not sufficiently developed to be able to rapidly respond to an Ebola outbreak and combat it and stop it. Right now, the international community is having enough challenges mobilizing the resources necessary to respond to the crisis in the most affected countries, and it would be truly devastating if we had to, if we were to see outbreaks in other countries, first and foremost because of the human toll, but of course also because of the challenges it would present in getting it under control. However, there are many good things that are happening. Some of the worst case scenarios of sustained exponential increases in the number of victims have not materialized. Indeed, we have seen significant improvements in some areas that had been very hardly hit, such as Monrovia. And there are two main reasons for these dramatic improvements. First and foremost, the communities themselves, the local communities who have taken action, who have changed their behavior in order to protect themselves and their members, and they deserve tremendous credit for what they've done. Secondly, has been the response, the national-led response with the support of international partners. We see the governments of Liberia, Sierra Leone, and Guinea taking a strong leadership role in delivering this response. And there are a few elements necessary for a successful response. First and foremost is that national leadership, which we now see and have for a while see in each of the three countries. We also need a national plan, and the heads of state, their officials have developed a national plan in each country. Then there are the four key interventions, the Ebola treatment facilities, the contact tracing and diagnostic capabilities, the safe burials, and the social mobilization. We need all of those. But those activities need to be supported by the enabling activities underlying them, logistic support, training of personnel, payment of national workers, the information management, and human resource mobilization. I really would like to pay tribute to the national governments, the United Nations agencies, and key partners such as the African Union and ASOA, led by General Keta, as well as ECOWAS, NGOs, bilateral donors, for all the work they have put in place to deliver these activities, because where we are able to combine that national leadership with those national-led and internationally supported interventions, we see dramatic improvements. The strategy adopted by the government, supported by UNMEER and other partners, works where we are able to put it in place. As many of you know, we have a goal of achieving 70% of cases, new cases in a treatment facility, and 70% of burials done safely by December 1. According to the latest WHO numbers of known cases, we are already at 55% of case isolation and 87% of safe burials. However, the real numbers are not as encouraging because there are many unknown cases, unreported cases. So those percentages in reality are lower. Nonetheless, tremendous progress has been made. However, as the chef de cabinet said, this is an elusive disease. It is moving around quickly. It is posing tremendous challenges to the governments and the United Nations to respond. From the beginning, UNMEER needed to be a knowledge-driven, flexible, nimble operation. One of the biggest challenges we face is getting good information, knowing where we have to be, and we need to act in a way, instead of always chasing the disease, getting ahead of that. Ebola is a fearsome enemy, and we will not win by chasing it. We must get ahead of it, and there are two implications to that. First, we need, as UNMEER and the responders, we need much greater geographic dispersion of our interventions. Secondly, we need much greater mobility and a rapid response capability. And Liberia is leading the way on this with the development of a rapid isolation and treatment for Ebola capability. Right. In terms of UNMEER activities, we have our 30, 60, 90-day plan. Since the last briefing to the General Assembly, UNMEER has been very busy putting in place the capabilities on the ground required to implement our mandate. We are operational in 3 countries with a headquarters in Accra, and I'd like to express deep gratitude to President John Dramani Mahama and the people of Ghana for hosting the UNMEER headquarters so graciously. We have more than 142 people across the 4 countries. More than 200 vehicles have been delivered and many more on the way. Helicopters and planes put in place. 8 logistics bases open, more about to open. We are working closely with the governments to provide critical crisis management function and ensuring a coherent and holistic United Nations system-wide response. As the Secretary General's Special Representative, I have visited each of the 3 most affected countries 3 times and had the privilege of meeting with the head of state on each occasion. The collaboration and consultation and partnership between the national governments and the United Nations is excellent. UN agencies, WHO, UNICEF, WFP, UNDP, OCHA, UNFPA have been doing a tremendous job in accelerating their own response on the ground and delivering the activities that they have committed to. Mr. President, following the adoption of Resolution 69/1, the Secretary General established UNMEER on 19 September, and it is timely to assess the mission's performance. As a career United Nations official involved with crisis response, I believe that the United Nations, under the Secretary General's leadership, has responded to the unique challenges of Ebola in an unprecedented, innovative way across bureaucratic barriers to deliver a robust, tailored crisis response capability in record time that is now working in close partnership with the national governments to confront the singular menace of Ebola. This is an accomplishment that everyone associated with it, including all those in this chamber, can rightly be very proud of. At the same time, as head of the UNMEER mission, with the responsibilities that have been entrusted to me, I fear that I have not done enough and that we collectively must do more, much more, and we must do it faster. Too much is at risk to do anything other than everything possible. In terms of going forward, our greatest needs within UNMEER are more staff. We need more staff to be deployed to the districts to work where the disease is, to be flexible and nimble and get ahead of the disease. In terms of the broader response, what's needed most are, as we adjust our strategy to the geographic dispersal of the disease, we need more Ebola treatment facilities, smaller ones, but more located in a dispersed manner, more community care centers, more partners on the ground to staff these centers, particularly giving the critical management skills to safely manage these facilities. We need greater mobility for the teams, and we need money to pay for it all. Most important, Mr. President, what is most needed, above all, is support and solidarity for the governments and peoples of Guinea, Liberia, and Sierra Leone. Government officials like Minister Niemsua, who have hardly slept for months, teachers out of work, students out of school, families who have lost loved ones and livelihoods, the thousands of Ebola orphans, communities who are in denial, devout believers who cannot practice their religious traditions, survivors suffering stigmatization. They all need our support and solidarity. For these people and all their countrymen and countrywomen and all the aid workers who are putting themselves on the front lines of the fight to defeat the menace of Ebola, we must do everything we can, more than we are doing now, to help them in this time of crisis. We must respond not with travel bans and quarantines based on fear, but rather respond with the energy, commitment, and resources necessary to end Ebola where it is as quickly as possible, to prevent it from spreading to other societies and putting them at risk, to prevent more people from dying unnecessarily. Thank you, Mr. President.